and I would like to welcome all of you. It's so fun to see some familiar names and faces in this group. I am Peggy Conway. I am your Director of Alumni and Constituent Engagement here at the Neeley School. And we're pleased to have you join us for this particular event, Neeley Networks in Healthcare. This is just one of many ways that the Neeley School seeks to support you in your lifelong growth and success, career success. And in fact, on Monday following this session, I will be sending out an email to give you a list of additional learning opportunities and networking opportunities with Neeley for the fall. So watch for that email. And in addition, in that email, I will include a list of the individuals who registered for today's event and who agreed to share contact information. So you'll have a chance to connect with those folks in any way you want to following today's event. That email will also have a link to today's session, which is my way of telling you, yes, we are recording today's session, so please be aware of that. And to help reduce some of the background noise, if you'll stay muted during the presentation part of the event today. So with that, it's my pleasure to introduce you to our host today, who is Dr. Valerie Johnson. Valerie is an Associate Professor of Professional Practice of Healthcare Management here at the Neeley School, and she is also the faculty lead for our Healthcare MBA program. So Valerie, we turn it over to you.
Great, thanks so much. Peggy, thumbs up, the audio's okay for you? All right, very good. Thank you guys for joining us today. Any of you who know or have worked with Peggy know that she is a lot of fun to work with, and we've been having a really good time fostering the alumni community who has found their way into the healthcare industry in some form or fashion. So thanks for being here, and we'll continue to do this. Hopefully it's fruitful to you, and it's a lot of fun for us. So my role here today is very simply to welcome you on behalf of the Healthcare MBA here at Neeley, one of the newest graduate programs. So if you know folks that are interested in pursuing that Horned Frog education, we would love for you to just share that the program is now up and running and vibrant. If you have questions along the way during the guest speaker's presentation, you'll have a chance to talk with one another, but we also want to give time for you to present comments or questions to the speaker, so you can type those in the chat, and we may just ask you at that point to unmute yourself and ask your own question, but I'll know you have a question if you'll type those into the chat along the way. So our guest today is Nelson Mann. Nelson is a senior partner at WittKieffer's healthcare practice, and he has more than 25 years of experience in identifying CEOs, COOs, CFOs, and other C-suite and senior leaders on behalf of not-for-profit and for-profit hospitals, health systems, integrated delivery systems, managed care organizations, academic medical centers, medical schools, and group practices. So he has a depth and breadth of experience in healthcare executive search. He is based in Austin. He's a member and a fellow of the American College of Healthcare Executives, and he regularly speaks at events for ACHE, to the Healthcare Financial Management Association, and other of our industry organizations. He is also a guest lecturer in the MHA program at Trinity University in San Antonio. And perhaps most importantly, his undergraduate degree is from TCU. He has his BBA in marketing and an MBA from UT Austin. So Nelson, thanks so much for being here, and we'll turn it over to you.
Thanks, Valerie. Welcome, everybody. It's good to be back on campus. I'm usually not back here until football season starts, so a little early this year. But we've got about 20 minutes together, and so I'm going to share screen if I can. Let's see. All right, here we go. Okay, so our agenda is pretty short and sweet. We've got about 20 minutes together, so we'll go through a quick introduction and talk about what's going on in healthcare. You know, the title of the presentation was career planning in healthcare post-pandemic. I almost struck the word post because we're not done with the pandemic yet. But we'll talk about kind of what's going on right now, a little bit about the search process, and then any questions that you have along the way. So WittKieffer, if you haven't heard of us, we're probably the largest healthcare executive search firm in the country. We've got offices all over the place, although our offices are shrinking because we're going more remote and more hybrid, like most organizations are these days. We're in a lot of different areas. Healthcare is our primary practice. We have about, I'd say 100 consultants, and most of those are in healthcare. We also do higher education. We actually placed Don Whalen at TCU back in 2005, and we're doing a current search for a vice chancellor. We have an academic medicine practice. We've got an interim business. We do life sciences and pharma, and we also have an international group. So, the first thing, for those of you that don't know is when you're talking to a recruiter, it's good to know who you're talking to, what kind of a recruiter. So organizations have their own internal recruiters that work directly for that organization. There are also contingency recruiters, which means they will actually work harder for new careerists because they don't get paid unless they make the placement. And then there's retained consultants, which is what WittKieffer is, and it's more at the senior level. And so they retain us to basically do that CEO search or whatever it might be, and we manage the search for them and present the slate of candidates. So what's the state of healthcare right now? 2020, March of 2020, our business came to a screeching halt. Nobody was talking about search. We actually went through a RIF. We let about 35 people go. And so things were really quiet. In July, people started waking up, July of last year, 2020. And so, ever since then, WittKieffer has had our best year ever, which is shocking after, a pandemic. But it just shows you can't go without good leadership for very long. An interesting stat I just saw was about 50% of the workforce is open to hearing about new opportunities right now. I think that's the highest it's ever been. Another stat that I just read on LinkedIn this morning was a higher percentage of senior executives are ready to go back in the office than the younger you get, the more comfortable you are working remotely. And so it's interesting because the senior folks are making the decisions a lot of times, but just like our company, we're having to adapt and work on. We have associates that work for us. We used to require them to be in an office, and now we're letting them work remotely. So that whole structure is changing. We were just talking, there's a higher demand for interim leaders right now than there ever has been. Senior executives and mid-level executives are wondering, okay, after what we've just been through in the last year and a half, am I ready to retire now? Because I'm burnt out, tired. And so a lot of people are making that decision to get out, not just in healthcare, but in really all the organizations that are out there. We can't find chefs in Austin. People have gotten out of the fast food or the food business because it was so stable and then it just went away, and so they found something else. There's a real focus on diversity, equity, and inclusion right now. We just hired a inclusion officer. And actually, we're doing a chief inclusion officer for TCU right now, our education practices. Obviously, telehealth has exploded. It fast forwarded 5 to 10 years just because it had to. And so that's here to stay. I do foresee a tsunami of acute conditions and behavioral health issues that are coming. And if they're not already here, that's going to be a huge burden on our healthcare system. And the video medium's here to stay. I'm not a big Zoom guy, but I've had to become one. I figure that I can get about 75 to 80% in a Zoom interview versus a face-to-face interview. So whenever I can for a CEO interview, I feel my clients are paying me to do something in person. So I do that whenever it's possible. I just wanted to if hopefully this is going to work, just show you a brief clip that I thought might be interesting. It's just a 2-minute piece, but it's a different perspective, and it's really called "The Pandemic is a Portal."
Nelson, we can't see the video.
Oh, that's a problem. That's interesting.
We can always send it in the follow-up email if we need to do that.
Yeah, let's go ahead and do that. Sorry about that. Back to you. All right, so let's see. Now my screen's not advancing. Start again. Full screen. All right, here we go. So there's some trends that are really impacting healthcare right now. First of all, consolidation. You know, the big healthcare systems are buying up community hospitals. It's kind of a dying area. And so what that's doing is fewer CEO roles in hospitals, because they're being gobbled up by systems, and they're losing the ability to chart the course because they're part of a bigger system. So instead of reporting to a board, they're now reporting to a person who's their regional boss, and that's fueling a lot of people looking for new opportunities. More specialization at the executive level. Again, frustrated hospital presidents because they've got less scope and span of control, and more centralized decision making. The integration of all different types of organizations is huge. There's all kinds of new entrants, consumerism and commercialization. We're doing searches for Walmart right now as they're ramping up their healthcare piece. All kinds of positions that are in demand right now. I'll go through them real quick. Chief medical officers, chief clinical officers, physician CEOs, chief diversity officers, clinical integration and pop health executives. Chief transformation officer is a big title right now. Interim executives and informatics. And then of course, cyber security executives, because the hacking has gotten out of control. As far as positions that are really in demand right now, ambulatory is huge. Everything continues to move to outpatient, and that includes physician practice leaders, service line folks in the most popular service lines such as oncology, cardiovascular, behavioral health, clinically integrated network development as well. Chief experience officers are another big one. Social media strategists, talent acquisition, integration specialists, and of course, diversity and inclusion. So, what are competencies that are in demand right now? Most organizations now are very matrixed reporting. So you don't have a lot of line responsibility, but so you have to really learn to manage via influence rather than, because I'm your boss. A lot of organizations work in dyad partnerships at the top. So there's a administrative lead and a clinical lead, usually a physician, working together on strategies for service lines. Really looking for system thinkers, problem solvers, innovators, and probably the biggest one right now is adaptability, because you've got to adapt in the changing world of healthcare. I put a slide up here for the search process that we use for CEOs, just so that you're a little bit familiar with it. When we're retained to do a search, we'll go and we'll meet with all the key stakeholders and get the input about what you're looking for, what the culture's like, and what's going to be a good fit within the organization. We then go out and do a national recruitment. We've got a huge database. We'll post the job, and then we'll do a lot of original research to find the candidates. We'll then bring back a slate of candidates to the search. If it's a CEO search, they generally have a search committee that's assigned to do the work. And we'll present. I just presented a slate yesterday in Dallas for a CEO, and we presented, I think, 8 candidates, and we asked them to narrow that down to 4 or 5 candidates to move forward in a first round process. Most first round processes, even for CEOs these days, are being done via Zoom. It's just faster, it's easier. It's not ideal, but it is what it is in this kind of an environment. So those, we generally see about a 75-minute interview via Zoom in the search committee, and we try to do them back to back so that they can compare candidates in a very short period of time. What we do is have a 5-minute elevator pitch. Candidate gets questioned, and then we've got time for the candidate to ask questions at the end. I don't know how many of you have been through behavioral assessments, but we have a behavioral assessment that we use. It's about 2 hours online and a 1-hour interview with one of our industrial psychologists. Final interviews, generally 2 or 3 candidates, and that's in person virtually all the time now. And then we meet with the search committee and ask them to choose a candidate and make an offer. So that's what the process looks like generally with us anyway. We'll go back. So really there's 2 things that we're looking for: the experience, which is your resume, and the competencies, which is your soft skills. And we factor all that in there. So what are the competencies in a CEO profile? You can see a whole host of things that are up there as far as soft skills. I know I'm throwing a lot at you, but looking at this list, any thoughts on what might be the top thing that search committees are looking for in a CEO? And because there's so many people out here, I'm just going to go ahead and get right to the answer. Integrity, which is the last one on the second column there. That's the thing that search committees are looking for, because if you can't have a CEO that you can trust, you're lost. So I've gone through this at a very high level. I'm going to spend some time with the current students in the next hour, talking about a lot deeper things like resumes and interviewing and that sort of thing. But open to any questions that you all might have.
And we didn't mention that, by the way, Nelson's speaking to you in a room that includes a group of our incoming new healthcare MBA students. So that you're getting the opportunity to join their orientation, if you will. So.
Thanks, Peggy. Thanks, Nelson. I know that, Patrick, I'm going to ask if you're willing for you just to go ahead and unmute and pose your question.
Yeah, absolutely. Thanks. Hi, Nelson. How's it going?
Great.
Yeah, I had a question about, you mentioned physician CEOs, and I know there's kind of a split, and different organizations go at it differently. Some only want physician leadership, especially at the C-suite level. They want doctors or nurses, clinicians, and others prefer more quote unquote business types. Are you seeing any trends with all the consolidation that's going on? Are folks moving away from physician leadership because there's so much of the vertical integration happening, or is there a trend maybe more towards that, or more towards a model where you always have kind of a clinician and a businessy type person? And I've seen the triad model with doctor, administrator, nurse kind of thing. Are you seeing any trends in those directions?
Yeah, that's a good question. I would say, if anything, it's probably more towards physician executives. Not that it's mandated. Sometimes it's mandated, but usually not. But if everything else is equal, a physician executive that has the administrative and operational skills could have a leg up. And it really depends on the organization. But I'd say it's probably trending more towards physician executives. 5-10 years ago, there just weren't that many physicians that had operations and administrative experience. Now that that's changed a little bit, and there's a bit more supply than there used to be.
Thanks for that.
Thank you.
you see the move toward
Brian, you want to unmute and ask your question, or would you like for me to pose it?
I unmuted and I'll ask it. Thanks, Nelson, for that insight. It was a lot of information in a very short time, but a lot of good information. So the question that I have is, you talked a lot about jobs that you see that are expanding in terms of the amount of searches you're doing. What jobs are you seeing reduce searches, and what jobs are going away that, we're not going to see as much in the future?
Well, that's a good question. I really haven't thought about jobs that are going away. Well, I guess really the only thing would be independent hospital CEOs that I can think of, because they're a lot of times they're changing the name to presidents now if they're part of a system. So there's fewer CEO titles out there than there used to be, and the president's job is a little bit different when you're within a system, as opposed to being in an independent hospital reporting to a board.
Yeah, so Nelson, I have a curiosity question. Since you've affirmed sort of the trend for more and more physicians in the CEO position, it's always been curious to me why the nursing profession hasn't also found their way there. Do you have any insight to that?
Another good question. There are some nursing executives out there. I think one of the reasons that there's not more is, when you come up in as like a CFO or a chief nurse officer and move into executive roles, sometimes it's difficult to let go of nursing. And so you tend to go back into your comfort level. If you've been a CNO and you become a CEO, you tend to overmanage nursing sometimes. Same with CFO. If you've come up that route, sometimes you fall back into what you know, and that creates a little bit of discord in the executive team. Also, there's still some nurse versus doctor issues, and especially with the old time physicians, where physicians might have a harder time dealing with a CEO who has a nursing background.
Yeah, good point. Kathy, you want to unmute?
Sure. So my question, Nelson, is really focused more on the post-acute space, and what type of work does WittKieffer do in this space, and with value-based payment and integrated leadership between acute and post-acute? Are you placing candidates in post-acute, or what do you see from a leadership perspective?
Yep, that's a great question. We actually are big enough to have service lines within WittKieffer. We've got our academic medicine practice. We do have a long-term care or post-acute service line of people that do that. What we're seeing, which is really interesting, is, the not-for-profits have not traditionally done a good job in managing post-acute. They don't really understand it. They feel like, they can reduce length of stay by having, a post-acute home health, LTACs, things like that. What we're seeing more of are partnerships between for-profit organizations that are running them at a profit, and with the not-for-profit system. So that partnership between some of the not-for-profit systems and the for-profit post-acute facilities is a trend that's really heating up.
Thank you.
Anybody else have a question?
I had one more. You mentioned DEI initiatives being a big push. What does WittKieffer do to ensure that you get a good panel of candidates, and to ensure too that the search committee is not biased in any way when they go through and review the candidates, especially with so much being done ahead of time to screen before they actually even see anybody? Yeah,
we've kind of been at the forefront of diversity for quite some time, and we just hired a chief inclusion officer for our firm. So it's interesting. There's a lot of things going on in that field, and we pride ourselves. I think diversity definition is always up for grabs. I mean, Females can be considered diverse a lot of times, ethnically diverse. So I think about over 50% of our, no, it's more like 60 or 70% of our slates have a diverse slate of candidates. What we're finding now is almost some reverse discrimination, because most of my clients want to hire the best person, but if there's a tie break, and diversity is a big issue, then the diverse candidate's going to get the job. But another interesting side effect of this is, because there's such pressure to have a diverse slate of candidates, we're getting pushback sometimes from candidates that are basically asking me, Nelson, am I on the slate just because I'm a diverse candidate, or am I really a competitive candidate for this search? And that's a good question. And I've had that from females as well, in kind of maybe a southern state in a rural area. Are they really interested in hiring a female CEO? So it's really interesting to see what's happening to that. But it's on the forefront. But if I can get on my soapbox for just a second, healthcare is way behind in having diverse senior leadership teams, and I think it really starts at the board level. If the board is not diverse, then it's not going to be a priority for the senior leadership team. So I really feel like we need to build up a pipeline of diverse board members, because once the board, is diverse, then it's going to be a priority for the senior leadership team to make that happen as well. So I'd love to see, I've actually talked to our firm about putting together a list, because if you ask a diversity board member how many boards they're on, if they're on one, they're probably on 6, because everybody wants them. But what we need are more up and comers and people that can be mentored by people that are on boards already, so that the talent pool of diverse board members is built up.
Great, thank you.
Yeah, that's really useful insight. So you talked a little bit about the executive search process, and I'm just wondering, kind of as we close out this part of the Q&A session, what do you have any tips for someone who is preparing to go into that search process? Any tips for preparing well?
Sure. First thing is prep and research. I've seen CEOs that prepped really well to go into a first round interview, and this would be in person, and they knew everybody in the room, and they walked up and said, Dr. Smith, it's so nice to meet you. And they knew something about him, and they said, I saw that you graduated from XYZ University, and that first impression is so important. And so use your resources to these LinkedIn, and that's a whole nother thing I'll talk to this group about, is making sure that you've got a really up-to-date and professional looking LinkedIn profile that you can do a lot of research that way. The other thing is network, to see what you can find out about the organization. And if any of your colleagues, professors, people in your network know anything about the organization, that can give you some insight into what the culture's like, what the person that you'd be reporting to, looks for in candidates. So, and then, the interview techniques, again, we'll be talking to this group about it, but you kind of need to have an elevator pitch. And if you don't, you need to come up with one. And it's a 5-minute, here's why I'm a good candidate. Here's why I'm interested. And here's something a little personal about myself. And that's something that requires some practice to, so that, you've got a spiel, so to speak, when you're networking or when you're interviewing, so that people know what you're looking about. And the other thing that I'll tell you is the passion. All my clients are looking for that fire in the belly, but it's got to be a natural passion. And so what I tell people is, think about what you're passionate about, whether it's developing people, growing programs, performance improvement, whatever it is, and tell stories when you're interviewing to articulate that. Because when you talk about something that you're passionate about, I'll give you a great example. As a search consultant in healthcare, I feel like it's a calling for me, because if I find the right CEO for the right organization at the right time, indirectly, if that person has an impact on the community, I indirectly had a piece of that. So it's, you know, an old mentor used to say, if you find a job that you love, you'll never have to work another day in your life. And so finding out what those passions are and then working those stories into the interview process about, you know, when you're talking to people is really powerful because they get to see that natural fire in the belly. I could go on that at 30 more minutes, but we don't have the time.
And we may come back to that, but yeah, thanks. So what we know is, so, you know, Peggy and I try to tee up some content that we think might be interesting to a broad audience, but what we know is there's so much intelligence among the participants. And so we want to have a chance to share that as well. So we are going to set up a number of breakout groups, and we have asked some folks to sort of serve as a facilitator to make sure that there's some movement in the breakout groups, but that's not meant to be prescriptive. So you should have someone in the group who's at least trying to spur the conversation along, and they'll have some prompts that we want you to talk about unless you come up with something else. In particular, though, we're going to ask you to come back after about 10 minutes or so, and we want to hear what you had to say about this topic. So stick with us, because I think you'll want to hear from your peers on this subject as well. Peggy?
And Valerie, there may be more than one facilitator in each group. Okay, so we'll send you to those groups now. Oh.
We did.
Can you put them back?
We did intros.
We're putting you back just 1 second.
All right.
Are you all in one group?
No.
Want to hear what you guys are thinking about career planning in terms of the sectors that we sent you into. So Zach and Lance, the two of you were together for a while, and so I know you have all the answers to offer the rest of us about payer risk and value. What do you guys want to share?
Big figures you'd throw us out first. Hello, everybody. Lance Donkerbrook. I'm the CEO of an accountable care organization out in Phoenix, Arizona. Participates in the Medicare Shared Savings Program. One of the biggest things we're trying to do is to get our providers into more risk and more value-based care. Phoenix is still largely a fee-for-service driven market, so that risk to value proposition is a tough one. How do you make that transition from fee-for-service? And you know, one of the things that Zach and I talked about, you know, from our perspective as a physician group, we're generally the least capitalized to be able to back risk and do things, even though we're the ones that are in the best position to do it. So in looking at how to do that, you know, out here in Arizona, everybody always looks to California and all the sophistication and risk and everything they have out there. But I want to turn it over to Zach because he had some great comments on that. You know, when we're talking about, you know, the reality of how it is in any region versus, you know, the rest of the U.S.
Thanks, Lance. So Zach Westbrook, an MBA grad from 2016. I spent most of the last 5 years with Blue Shield of California, working on the health plan payer side up in the Bay Area. And to Lance's point, you know, the California market, I think a lot of times gets held up there as maybe a little more advanced, particularly in the healthcare space as compared to some other markets in the U.S. But in all honesty, a lot of times it's just because it's such a big market that it feels like there's more advanced work going on. And on a percentage basis, it's really similar to the rest of the country. So from a risk and value proposition, the kind of work that Lance is doing and trying to make that transition to those value-based care arrangements to get providers to take on risk continues to be difficult across the industry, and there continues to be just a ton of career opportunity in that space for people who want to work on those issues and try to help move the healthcare system along.
You want to say a couple more words about those opportunities, Zach? What types?
Yeah, well, there are plenty of accountable care organizations, small and large, similar to the one Lance leads, and then large multi-state arrangements as well. There's all sorts of opportunities to work on those kind of accountable care arrangements and value-based care arrangements at every single payer, health insurer in the United States right now. So you can go locally in Texas with any number of the national players and the local players. Everybody's looking for talent that wants to work on this and has innovative ideas in this space, because it really is the big challenge for the industry right now.
All right, very good. So Kim and Hazel, you are the other group of two, and so you might want to respond from the acute and ambulatory care space. What insights do you want to offer, maybe in reflection on what either we have just heard or what Nelson had to say?
Hi, this is Kim Epperson. So Hazel and I talked some about just differences that we're seeing in leadership structure and the importance of alignment in goals across those structures. So, you know, her experience is that they're moving away from a triad leadership. My experience is that we're moving toward to bring better alignment in developing and implementing strategic initiatives across the clinical spectrum. So that was primarily our discussion. You know, they're in the ambulatory and acute environment right now. You know, I think talking with my colleagues, there is a great deal of opportunity to shift into leadership roles. There is a lot of transition. Unfortunately, some of that is from you know, just the stress and strain of this last year. And so it, you know, I think it presents some opportunity out there in the marketplace, but certainly a difficult time in thinking about timing of career changes especially in the acute space.
Yeah, for sure. Thanks for that, Kim. So we had a number of you, our largest group, and so I'm going to have to give you sort of a minute and a half or less with the consulting and service providers. So Andrea, Patrick, Brian, how do you want to sort of tell us what the discussion was about there?
Rock, paper, scissors, Patrick gets to go.
Wow. Yeah, we had a lot to talk about. We kind of agreed that integrity was definitely the number one issue. And we're talked a little bit about some differences between, and this is something I hadn't thought about before, differences between leadership in different types of organizations. So like, for example, a pediatric hospital versus one that's more focused on adult care, and you know, the different types of leaders you may need in different types of environments. So it's you know, there's not just a one size fits all C-suite person. There's the right person for the right job, and then also at the right time, depending on what that organization is going through. Do you need a transformational leader? If there are, you know, are changes that need to be made, do you need somebody who's focused more just on the finance piece and on the money? If you're in real kind of dire straits, you need to right the ship. You need somebody who's focused on innovation if you're lagging and you're non-competitive. So some of those kind of things. I talked about DEI perspective from the physician, non-physician standpoint, which I hadn't thought about either. I thought that was an interesting take. You know, just because somebody has NBDO at the end of their name, does that necessarily, it is good, but does that necessarily make them the best person for the job? Even if they've done some work in the past, do they really have the chops to do what it is that needs to be done based on the nature of the organization, how that organization is positioned within the market, how they need to compete, how they need to you know, adapt and adjust and move forward. And I know I missed some stuff, but we also talked about just some external.
I can talk to you, Patrick.
Oh yeah, jump in, please.
Quickly, Brian.
Yeah, you know, I'm always brief, Valerie. I think the other thing that kind of struck a chord for me was Nelson made a good point about how hospitals saw that physician leadership 10 years ago was a void. And so they did a great job of building their pipeline, and now they're starting to see the fruit of that labor. Whereas, so I work for a physician company, And so we've got 240 physicians that work for us, and it's really hard for us to find leaders. So I think hospitals have done that really well, and physician organizations or physician practices have not done as well in that. And so I think that's an area for us to trend up in the next 10 years.
Interesting. Yeah, really interesting point. So Kathy, you got about a minute or so to tell us what you guys talked about in the technology and innovation space.
Yes, and I think that Derek is going to speak on our behalf, and perhaps Anna Ruda will jump in and say a little bit.
Perfect, thanks.
Yeah, our topic of conversation, real quick, I work for a healthcare venture capital firm here in Austin, Texas. Been here for a handful of years. So our job is obviously finding new tech and innovation, right? And we're on the early stage side. So that's where a bit of my perspective comes from. But, overall, coming out of the pandemic, we saw obviously a forced adoption to a lot of things that have been talked about for 30 years. And so that's obviously been pretty exciting for a lot of folks. On the flip side, for the larger institutions, health systems, payers, et cetera, it's also been decently overwhelming. And they have had to try and find ways to adapt at, C-suite execs who usually have not had to do that for 25 years. And so that trade-off's been tough. They're much more open to it, which is fantastic from obviously our perspective, but nonetheless, it's been quite the wave and interesting to kind of see. The nice thing about it, Jeff touched on this in terms of his background and his career also, is just pushing new ways of providing old school care. And so you've got challenger health plans, you've got mental health has completely changed in terms of how you deliver that care. Holistic integrated wellness on the primary care side, that was an age-old industry for a long time. They're doing things quite differently now. And then obviously value-based, which we've touched on as well. All those things, pretty significant tailwinds coming out of the pandemic. And you start to see quite a bit of that. But nonetheless, there's goods and bads, but definitely never seen as many startups and innovation as we've seen today. I mean, it's 5 times what it was 10 years ago. So it's pretty exciting.
Yeah, challenge and opportunity. That's right. Okay, Peggy, I've taken more time than I should have. We have a minute left. How do you want to wrap?
Well, I want to tell everybody, thank you so much for joining us. We're just glad that you could be here today. You'll be getting, as I said before, a follow-up email from me on Monday. And part of that will also be asking for your input. Let us know if you're liking this format. Let us know what topics you want. We will also have some on-campus opportunities for the folks that are in Dallas-Fort Worth, so watch for that. But other than that, just thank you very much. And I guess go Frogs, right? Okay, right. Thank you very much. Enjoy your afternoon.